Which of the following examination findings requires further testing and/or consultation with a specialist? A. Direction changing nystagmus on change in head position. B. Direction changing nystagmus on change in lateral gaze. C. Positive head impulse test. D. Torsional upbeat nystagmus during Hallpike test. Answer is B. Direction changing nystagmus on change in gaze is concerning for a central cause of vertigo and makes up part of the Hind's test. Internuclear ophthalmoplegia most often suggests a diagnosis of A. Horizontal canal BPPV. B. Labyrinthitis. C. Multiple sclerosis. D. Vestibular neuritis. Answer is C. Internuclear ophthalmoplegia is diagnosed when, on eye movement, the adducting eye shows little to no movement while the abducting eye moves normally. In a vertigo patient, this finding is virtually pathognomonic for multiple sclerosis. Which of the following is a central cause of vertigo? A. Labyrinthitis. B. Meniere's disease. C. Vertebrobacillar insufficiency. D. Vestibular neuritis. Answer is C. All the other causes are peripheral. Continuous vertigo of what duration is used to define acute vestibular syndrome? A. 1 hour. B. 8 hours. C. 24 hours. D. 1 week. Answer is C. Acute vestibular syndrome has an arbitrary cutoff of continuous vertigo for at least 1 day in part of help differentiate acute vestibular syndrome from attacks of Meniere's disease or prolonged migrainous vertigo. The most appropriate initial evaluation of a patient with non-traumatic headache is A. CT scan of brain. B. EEG. C. MRI scan of brain. D. Thorough neurological evaluation. E. Trial of NSAIDs for pain relief. Answer is D. A thorough neurological examination may reveal deficits not seen on gross evaluation, prompting expansion of the differential diagnosis to include more concerning etiologies. Depending on the history and remainder of the physical, a normal neurological examination may be reassuring and obviate need for advanced imaging studies. In the setting of headache, the presence of nausea and vomiting are diagnostic of which of the following as an underlying cause? A. Glaucoma. B. Increased intracranial pressure. C. Migraine. D. Temporal arteritis. E. None of the above. Answer is E. Nausea and vomiting are completely non-specific. Migraine headaches, increased intracranial pressure, temporal arteritis, and glaucoma can all be manifested by severe nausea and vomiting, as can some systemic viral infections with headache. Such factors may point toward the intensity of the discomfort, but are not specific in establishing the diagnosis. Which of the following causes of headache has a constellation of risk factors that include age older than 50 years, female gender, history of lupus, and previous chronic meningitis? A. Abscess. B. Encephalitis. C. Increased intracranial pressure. D. SAH. E. Temporal arteritis. Answer is E. Risk factors associated with temporal arteritis include age older than 50 years, female gender, ratio 4:1, history of other collagen vascular diseases, such as lupus, previous chronic meningitis, and previous chronic illness, such as tuberculosis, parasitic infection, and fungal infection.